Hello! This video will discuss safety and emergency maintenance as well as medication management.
Many people have concerns about how to handle emergency situations after having a cardiac procedure. Some also have concerns about managing medications they take after a cardiac procedure. This video will provide information on safety and emergency maintenance as well as medication management. We will start by discussing ways to handle emergency situations.
One major concern many people have is what to do if they were to experience a cardiac event. A cardiac event can be any malfunction of the heart or the heart stopping completely.
The first thing to note is if something does not feel right, contact your doctor immediately. One might experience chest tightness, pain, shortness of breath, or a variety of other symptoms. Remember to stay calm and have your doctor's number readily available where you can find it easily. The most important thing to remember is if you are ever in doubt, call 911 immediately. The best way to be prepared in the case of a cardiac event where the heart stops beating and one stops breathing is to have caregivers know how to perform CPR. The key to saving a life is good quality CPR. CPR classes are available through many organizations. The American Red Heart Association provides classes in many areas and even offers online classes. You may ask your therapist or physician for resources in your area to take a CPR class.
If one collapses and stops breathing, 911 should be called immediately and CPR started. It is important to tell the 911 operator that you are starting CPR so they may send the appropriate personnel to help. CPR should be started and not stopped until emergency responders arrive and provide instruction on what to do.
You can also prevent emergency situations by listening to your body. If you are doing an activity that starts to feel too strenuous, stop and take a break. In other words, know your limits and don't be afraid to take time out and rest. Know your body and know when something doesn't feel right. This may be necessary at any time throughout the day, but especially when doing activities that require cardiovascular endurance, such as working out or doing athletic activities. Let's look at some medication management strategies. The first thing to note is you should always be aware of the medications you are taking. Know their names, what they do, and especially what side effects they may cause. This is important, especially in an emergency situation where you receive medical attention. Telling medical personnel what medications you take will allow them to provide you the best care. If you take a lot or have a hard time remembering, make a small list of them to keep in your pocket when going out. When taking different medications, it may be difficult to keep track of what to take, when to take it, and what you already have taken. Pill organizers like the ones here are cheap, found in many stores and come in different varieties so you can find what works best for you. Other ideas for keeping track of your medication are using a whiteboard to cross off or indicate that you have taken your medication. You could also leave visible notes to remind yourself to take your medication, such as on the fridge, coffee pot, or bathroom mirror. Another idea is to set alarms on your phone to remind you to take your medication at certain times throughout the day. If you are ever unclear about anything regarding taking your medication, call or talk to your pharmacist. Don't be afraid to ask any questions. It is very important to make sure you take your medication correctly. If side effects become severe or interfere with your day, talk to your doctor and do not stop taking the medication until you have done so.
Thank you for watching this video.